Hi there, and welcome to an oral health key messages and dental neglect session, especially for HAF providers. And this session is recorded in December 2022, so everything that I talk about is relevant as of 2022. So, without further ado, let's crack on. My name's Charlotte Iddon. I'm the Oral Health Improvement Manager for the Oral Health Improvement team in Oxfordshire. We're a commission service, just like yourselves. And yeah, it's as simple as that. So today's aims and objectives, really it's just to inform yourselves of ways to improve oral health for all children and the families that you're working with. So it's really that you're not going to be there assessing anyone's teeth or doing any of those kinds of things, but obviously there's quite a lot of things that you can do activity wise, which we won't be discussing today, but you can certainly give you food for thought on things that you could do around oral health, because I'm going to give you the key messages. So you could do simple activities around key messages directly with the children. And then obviously food and drink heavily impacts teeth. And so having a think about that as well. And then on your safeguarding radar, having a think about dental neglect as well. So I'm going to give you sort of knowledge around two main oral health diseases as well. And like I've mentioned, those three important messages, which recently in the last 12 months have been updated. So it's just good to know what's new. So what are the statistics? So in that, we're talking about the experience of decay. Decay is a disease. It's the most common disease to affect children, full stop, and it's the most common reason for children to end up in hospital. By the age of 3, which is probably younger than most of the children that you work with, but by 3-ish, most children have got their 20 primary teeth, baby teeth, the ones that are going to fall out. To monitor how many children have got rotten teeth or experiencing decay. Every other year, there is a national survey which basically looks at children who are age 5, and basically we just look inside their mouths and we have a look at whether they have got any decayed, missing or filled teeth. You can see here the data from the last few surveys. And we've got Oxfordshire broken down into the different districts. Now you can see the England average in the most recent survey was 23.4, so it's close to a quarter of all 5-year-olds having some decayed, missing or filled teeth. So that's quite a lot, isn't it? 25%, quarter is really quite high. And then we look at the breakdown of Oxfordshire in general, and we've got Oxford significantly above, and then we've got other areas significantly below the national average. So really, what are we thinking here? What's happening in Oxford that is forcing the numbers of children that have some decayed, missing or filled teeth to be higher than the national average? The answer is disadvantage. Children growing up in deprived areas. This is a few years old now, but I think it's a really nice, easy to understand pictorial representation of what is happening and is still happening for children growing up in those more deprived areas. So in terms of teeth, on average, double the number of children in the deprived areas or low-income households have twice as many have decayed, missing or filled teeth. And so it's socioeconomics that's at work here. So unfortunately, the children in those low income houses are probably eating and drinking a higher proportion of foods that's going to impact their teeth. So, high amounts of sugar. Interestingly, those kinds of foods, high sugar, high fat, cheap, highly processed foods, are also at exactly the same time as the rotting of the teeth, are also going to be impacting children's weight and their levels of obesity. So it's the same results here. So if you're a child living in a more deprived area back in 2016, you are twice as likely to be obese than your affluent counterparts. Now, obviously, this is quite old data. So what I wanted to show you was the more recent little bits of data that we have around teeth and obesity. Obviously, like I've highlighted already, closely linked together. In in 2020, the national survey decided they were going to have a look at 3-year-olds' teeth. Now, we all know what happened in early 2020, so the collecting of data was impacted by COVID, so they couldn't collect every county sample, but they did collect enough data before COVID scuppered everything to give us a national picture. So at 3 years old in 2020, the rates of dental decay, missing and filled teeth were just under 11%. That hasn't really changed significantly in the last 10 years, so it's always hovering around about the 10% of all 3-year-olds. But what was really worrying, this is pre-pandemic, was that it highlighted those children living at 3 years old in more deprived area, low income households, were now 3 times more likely to have rotten teeth, missing teeth or filled teeth. So that inequality gap around teeth, not only is it starting younger, but has got a third bigger. So something is not working here. We think the biggest driver for these rotten teeth, I've mentioned it already, is our diet. Which obviously has also an impact on weight as well, which we can see in the NCMP, so that's in the National Childhood Measurement Programme 2021 data, saw the biggest increase it has ever seen since they started measuring children in reception in year 6. Height and weight is measured. Overall, there was an increase of nearly 5% across the board in reception and year 6 children, bringing them up to nearly a third of all reception children and 40% of all year 6 children, leaving those year groups either being overweight or obese. So again, we know we have a problem there, and that those things need addressing. It's a complicated issue: food, access to food, money, etc. If you're living in a more deprived area, those barriers are going to definitely be there. So it is a problem. It's an ongoing problem. Your little window of being able to do something is obviously what you provide and what is in those children's lunchboxes, and providing some education around that. So that's sort of like where we are with children's teeth, and obviously linked heavily to levels of overweight and obesity as well. But we are going to move on now and talk about dental neglect. We will come back to food. So dental neglect can be defined as a persistent failure to meet a child's basic oral health needs. So here we're thinking about basic oral health needs being access to a toothbrush, access to toothpaste, watching them while they're brushing, supporting them while they're brushing, making sure they're doing it twice a day, and not providing too many sugary snacks and sugary drinks, which again can be tricky. It's when this persistent failure then has a serious impairment of the child's oral or general health or their development, i.e. they've got so many rotten teeth they can't make their sounds properly because those teeth have been taken out. So, you know, again, it's quite tricky sometimes to identify whether what you're seeing is dental neglect, or whether it is just poor knowledge. So really importantly, we're just going to have a think about when and what dental neglect could look like. So just poor oral health, so not even dental neglect, but just poor oral health and dental neglect itself will have an impact on the child overall. They are probably likely to be in some pain and discomfort. It will affect their sleep, and we know that affects their development and their learning. They could have swellings, infections beyond antibiotics, etc. So that's affecting so many things. It can limit how they speak and eat, which again, the things that they choose to eat may not then be healthy. It will affect their self-esteem and their confidence if they've got lots of teeth missing. It will impact their time at school and parents' time at work. They could culminate in having to have a general anaesthetic. That's those missing teeth. That's teeth taken out due to decay. And all of that is very likely to have then a very negative association for that child with their teeth and the dentist, or attending anywhere that is linked to their teeth. So really, we want to avoid all of that. And sometimes it will be just poor understanding, poor knowledge, and other times it will be dental neglect. So if you are concerned at all about a child's mouth, about their oral health, then really do follow those safeguarding procedures, speak to your designated safeguarding lead, and just raise your concerns. And the simple thing to do, of course, is to have a conversation with parents that you are concerned and what your concerns are. And if they feel the same way, do they notice it? Do they understand what it is? And obviously, we should be also thinking about, what does this smile also tell you about that child's lived experience? If the teeth are not being looked after, if basic routines, basic oral health needs are not being met, what else could be going unmet for that child? So it is a window into the health of the rest of that child's body, but also it could be an indication of what else is going on or not going on in that child's life. So what are the key oral health messages? So again, like I said, I'm not expecting you as providers to be, sharing all this information with children, but just having it in your back pocket as knowing what the key bits of information are. So if you had a concern or a worry about a child's mouth and the parent said to you, oh, well, I don't actually know what I should be doing, then you can say, well, actually, this is what you should be doing for brushing. This is what should be on your brush, etc., etc. So just making sure that you know what those key oral health messages are. So in terms of brushing, so I've kept it really quite simple. Obviously, we're going to brush teeth twice a day. I say obviously, I'm sure you are doing it, but don't assume that the children are brushing twice a day. When should we be brushing is obviously quite important. Before you go to bed is the crucial time, the most important time to brush your teeth. That's because your natural defense against tooth decay is saliva, and overnight your saliva decreases very dramatically. So it's not there constantly, what we call buffering, keeping your mouth a safe space for the enamel not to be damaged. So last thing before you go to bed should be done, and there should really be no food or drink consumed in the last hour before bedtime. And then it's brushing at another time during the day. So most of us do that first thing in the morning. That's absolutely fine. But some parents may be struggling, and the children may be struggling in that early morning routine. So it can be done at any other time. As long as they're getting 2 brushes in 24 hours, that's fine. They should be choosing a children's toothbrush with a small, soft to medium bristled head, and not using an adult's toothbrush because the heads are just too big for children's mouths. Change the toothbrush every 2 to 3 months, or when the toothbrush is looking splayed. Once it's splayed and the bristles start to lean out, when you're brushing with that, you can actually do damage to your gums. It won't do a good job at removing bacteria, and also can harbour quite a lot of bacteria. So if you've become ill, like lots of us are at the moment, once you start to feel better, I would strongly recommend that you change your toothbrush, because some of that bacteria will remain within the bristles. The brush itself is doing 95% of the job. It's doing a lot of the cleaning, a lot of the removing of the bacteria, but obviously we need to protect the teeth at the same time. And this is where we have what's going on the brush being quite important. So toothpaste has some guidance around about how much fluoride is present. And in terms of that, it's broken down into age ranges here, which I'm going to give you. And then in a couple of slides, I'm hopefully going to make it a little bit more simple. So children who are 0 to 3 years old, i.e. babies, probably younger than children you're looking after, they can't yet spit out. So they must have a toothpaste that contains at least 1,000 parts per million of fluoride. It can be a children's toothpaste or a family toothpaste, it doesn't matter. The crucial bit is that it's not whitening, not sensitive, and that parents only use a smear. So it's a grain of rice, and we smear it onto the brush so that it doesn't fall off in a blob and get swallowed before you've done the brushing. So the smearing is quite handy for all age ranges, really, so you can happily smear it on. But here we are using a grain of rice smeared onto the brush. At around about 3, give or take, some children will be earlier, some children will be later, they should have learnt to spit out. So they still need at least 1,000 parts per million. I've put in here 1,350. That's roughly the amount that you find in lots of adult toothpastes that are not whitening or not sensitive. And that's still 1,000, still at least 1,000. So you can happily use that. And it's the same with those 0 to 3-year-old children as well. So it can be a family toothpaste or it can be a children's toothpaste with the correct amount, at least 1,000. And here, because the child can spit, we've got a pea-sized amount. This is a children's toothbrush and this is the pea. So you can see it's a very small pea-sized amount, and that's the same for adults too. It's a very small pea-sized amount. Any children who are at risk. Now, at risk is very vague, so they're at risk of more dental decay than their counterparts. So it could be a child with a cleft palate, a child with diabetes, a child that's on a high sugar diet for whatever reason. All sorts of reasons, weak enamel, etc. They would be recommended from their dental team to have that higher amount of fluoride from the very beginning. Okay, so what you're putting on your toothbrush is really important. And like I mentioned, you don't have to buy lots of different children's toothpaste. Obviously, you're probably not going to get in the nitty-gritty of toothpaste with parents, but we are all trying to save money at the moment, and toothpaste is a really simple way to cut out a few pounds from your weekly spend. And it can just be that you buy one family toothpaste, your baby has a smear, and you and your children have a pea-sized amount. As long as it's not whitening or sensitive, children can use any toothpaste as long as it contains at least 1,000 parts per million of fluoride. Crucially, an important bit here is to spit and don't rinse. The reason we don't want to rinse is you've just spent 2 full minutes, that's how long it takes to brush your teeth using an electric or a manual toothbrush. So that full 2 minutes cleaning, a lovely toothbrush, getting into all the nooks and crannies, a 45-degree angle along the gum line, getting all the bacteria out. You've done that for a full 2 minutes. You've used a lovely toothpaste that contains the right amount of fluoride, and then you're rinsing it off. The fluoride will only work if it's kept in contact with the tooth surface, so with the enamel, for at least half an hour. That way, the fluoride can be absorbed into the tiny little holes that the tooth is made up of and strengthen and remineralize. That's the whole purpose of having a fluoride toothpaste, is so that it creates a protective layer and barrier on the teeth. If you're rinsing with water or mouthwash, it's stopping that from happening. We also recommend that supporting children to brush until they're 7 or 8 years old is really important. Why is this? I hear you ask. That's quite old. So we do say parents should brush their children's teeth for them. There can be some playing and children having a go until they're about 5 or 6, because they just don't have the manual dexterity to get in all the nooks and crannies. And then after the age of 6, up to the age of around 8, maybe 9 for some children, even older for others, we want to be closely supervising, so watching them brush, making sure they're getting on all the nooks and crannies, because if they're missing bits, those bits are going to get a build-up of bacteria and are then more likely to have problems. Okay, so obviously cleaning the teeth and putting on that protective layer is really important, because that's your only defense against what you're going to put in your mouth in terms of food and drink. And we do this a lot during the day: breakfast, snack, lunch, snack, dinner, snack, etc., including drinks too. There can be an awful lot of sugar and acid attacks onto the teeth, which will damage the enamel. So for children, we are thinking about reducing the number and frequency of sugary foods and drinks, i.e., do they really need a sugary snack every single day in their lunchbox? Do they need a chocolate bar every single day? I would be questioning that as well. Those kinds of things are supposed to be, I don't like the word treat, but they're supposed to be infrequent. We don't actually need them. They provide no nutritional value. So trying to encourage parents to reduce the number that is appearing in lunchboxes. I've seen some lunchboxes recently that contain 6 high sugar or high fat items in one 3-year-old's lunchbox. That is way too much. Thinking about portion size, a portion of whatever parents are giving them should fit inside the palm of their hand. So obviously it gets smaller for the younger the child and a little bit bigger for older children. Where possible, though, having the chocolate biscuit or whatever it is in the lunchbox is actually better for the teeth than having it as a snack. So what we're trying to say to parents is, have less sugary foods and drinks, but also try and have them with a meal. So put raisins on a porridge, put the chocolate biscuit in the lunchbox to be consumed with your lunch, and have a squash with your meal. That way, any sugar or acid is being consumed along with all the other food in your meal. And then once you've finished, your mouth can start to recover. And your mouth can actually cope with doing that 4 times in 24 hours. Any more than that, and damage will start to build up quite quickly. Fresh fruit and vegetables, like in the picture you can see, make a perfect snack. They're the best snack because not only are you getting part of your 5 a day, but also the sugar, which is found in both of these, so that's the fructose, is tightly packed inside fibre, fibrous tissue in both fruit and vegetables. When it's real fruit and real vegetables, bear in mind, none of this processed stuff in packets. So real fruit and vegetables, that fibre is going to protect your teeth from the fructose that is in fruit and vegetables. It's not going to do any damage. So they make the best snacks, and then it would be plain things otherwise. So as you can see here, these are things that all contain sugar or acid or both and would not make a good snack. I'm not going to call out each one. I think it's quite obvious. Some people are often confused with smoothies and think, oh, they're really healthy, aren't they? And dried fruit. Oh, raisins. Oh, my children love raisins. Children love raisins because they're so super sweet. But they used to be grapes once upon a time. But in the drying process, the fibre, that magic ingredient, has been broken down. Sugar's been concentrated. So they're a little bit like eating Haribo sweets. Sort of same levels of sugar, and they're very sticky and stick to your teeth. So if you want to have them on a porridge or as a pudding with a meal. The same with the smoothies. This used to be perhaps strawberries and bananas, and if you'd eaten the strawberries and bananas, they wouldn't damage your teeth and they wouldn't be classed as added sugar, so they wouldn't affect your waistline. But as soon as you smoothie it, you're destroying that fibre, you're releasing the sugar. Now it's bad for your teeth, and now it's added sugar as well. And a simple glass of smoothie can contain upwards of 15 grams of sugar, which is a huge amount considering that children, probably the age of children that you're working with, 7 to 10 years old, should be having no more than 24 grams of added sugar. So from the glass of smoothie, they're over half of their daily allowance. We're not saying don't eat things with sugar in them. We're just saying please try and encourage parents to cut down the amount and try and have it with a meal. Whereas these things here would be absolutely fine. We've mentioned fresh fruit and vegetables, and then we're thinking about low sugar carbohydrates, breads, crackers, rice cakes, breadsticks, those kinds of thing, all going to be low sugar. Plain yogurt, so not a sweetened one or a flavour one, cheese, milk and water. And obviously this is quite key. We see lots of children, especially in these holiday programs, that have got bottles of squash and parents thinking, oh, it's fine because it's sugar-free. Absolutely, you're not consuming sugar, so that's much better for the waistline. But in terms of the teeth, anything sugar-free has had the sugar taken out of it, but if it's fruit-based, it will still have the acid from the fruit still there. So the fruit squashes can be more acidic than a fresh orange juice. And then obviously every time you're taking a swig, you're getting an acid erosion effect on the teeth. So if they are sort of sucking and sipping on a bottle throughout the day, they are going to be damaging the teeth. A great way to signpost parents is to the Better Health food scanner. So it was relaunched earlier this year. It's a little bit cleverer now in that it scans things, it tells you the facts about it, i.e. sugar, fat and salt, and then it also recommends a swap. So that can be really helpful for those families that are finding it hard to know what to provide for snack or what to put in lunch boxes that is healthier. I've mentioned already this amount here, 7 to 10 years old, and here are the other sugar allowances. So from the green box onwards, 4 to 6, 7 to 10, and 11 plus, this is recommendations from Public Health England, which were back in 2017. The yellow and the pink don't actually exist. So Public Health England said, oh, we're going to have sugar allowances. So sugar allowances, maximum sugar allowances were introduced because we're all consuming too much sugar. And this amount of sugar as a maximum will not impact your weight, okay, or children's weight, as we've got here. What they didn't say was anyone who's younger than 4 years old. Now, I don't know about you, but there's plenty of children under the age of 4 that are eating chocolate, sweets, ice cream, cake, biscuits, etc. In fact, lots of baby foods that are marketed towards parents for their small babies will contain lots of added sugar. So it's definitely in their diet. So these two here are just recommendations for very small children, and they've come from our dietitian. So you can see they're much lower than other children. And here we have 11 plus adults. That's you too. So you should be having no more than 30 grams of added sugar in your daily intake. Now, just going to put that into perspective. What is added sugar? I will explain very briefly what it isn't. So the 5 things that I'm going to mention now are 5 things that you can eat and consume and not have to count the sugar. Okay, so you can eat fresh fruit, fresh vegetables, plain yogurt, plain milk, and plain cheese. Those items contain fructose and lactose, which are both forms of sugar, but they are, they are not going to do the same kind of damage as sugar in processed foods. Certainly not going to damage the teeth and are not really going to affect your waistline either. So this 30 grams is only from really processed products. So anything that it isn't fresh fruit, fresh vegetables, plain yogurt, plain milk, and plain cheese, anything else you're going to have to count, and it adds up really quickly. Okay, so here are some little snacks that you may well see inside children's lunchboxes that come and use your holiday programs. And I just want you to have a quick think. Are these tooth friendly? So we're just thinking about teeth, or are they processed rubbish? So we've got raisins, we've got the naked bars, not always allowed, are they? Because they contain nuts, some of them. So you may or may not see those. Rice Krispie bars, popcorn, What's-Its, yogurt breaks, Humziger fruit sticks, or Smoothie Bear fruit string yo-yo. Now, as we said before, anything that is low sugar is fine as a snack. So we've mentioned fresh fruit and vegetables, and then things like the crackers, the breadsticks, etc., should all come in at 5 grams or less per 100 grams. So when you turn over and you have a look at the ingredients on the back and you look at the nutritional information, it will say carbohydrates of which sugars, and it's that sugars bit you want to have a look at, and only look per 100 grams. Don't look per portion because that can be very misleading. Only look per 100 grams, and if it's 5 grams or less, you can have a snack on it and it's not going to affect your teeth. But if it's more than that, it's going to affect your teeth, and obviously it's going to start adding up quickly towards that maximum sugar allowance. So, and to put you out of your misery, raisins, I've mentioned them already, haven't I? These are high. So per 100 grams, they're 69 grams of sugar. So nowhere near the 5 grams, like colossally over. Nearly 70% of that is just pure sugar. The Naked Bar, over 50% pure sugar. The Rice Krispies bar, 29 grams, so not a single low item yet. The Yo-Yos, 50% sugar. The Humzingers, just 53%. The Go-Ahead bars, which again look very healthy. They've got lots of green on them, meaning healthy. They're showing you real pictures of fruit, but actually they are in the high category. So anything that comes in at 22 grams per 100 grams or more is in this red category, is in the high category. And then we've got the popcorn up here. So although it may look quite good and quite healthy, it's very close to the high, so it's medium sugar there per 100 grams. And the What's-Its, even though they're a savoury snack and you wouldn't necessarily thinking about them affecting your teeth, they are not. They're close to 5 grams per 100 grams, but they're not officially a low sugar item, and that always surprises some people. Not all crisps are created equally. These ones, the kind of melt in the mouth ones, will often have more flavorings because they don't really taste of much otherwise, and then the sugar quantity goes up. Whereas if you're choosing something like a Walker's crisp, obviously the saturated fat is high, but the amount of sugar is low, so not something that you should be having every single day. So what should be in a good lunchbox? So like I mentioned earlier, I do lots of what's called a lunchbox audit, where I have a look at what's going on mainly for 3 and 4-year-olds in nurseries, and I have a look at how healthy their lunchboxes are in terms of added sugar, saturated fat, and the number of calories. Calories is just a snapshot though. I'm really sort of focusing on that fat and sugar. So here, this sort of multicolored section at the top here is what should be in a good healthy lunchbox. Okay, but bearing in mind that where it says portion, it's a portion size fitting for that person. So if it's a small child, it will fit inside their palm. If it's an adult, it'll fit inside their palm as well, but it will be bigger. So there should be some starchy food. So that covers all sorts of things: bread, bread rolls, rice, pasta, quinoa, couscous, you know, quite a long list of things there, but there should be, you know, minimally processed things like the things that I've mentioned, not pastry items. A portion of protein doesn't have to be meat, but it can be meat, fish, eggs, beans, lentils, or any other alternative. So we could have corn in there, and we've mentioned lentils and things like that. So that would be a good one there. Obviously, at home, children can be having nut proteins, but I'm guessing that in most of your providers, you're in no nut settings. At least one portion of vegetables and at least a portion of fruit, and then at least one portion of milk or dairy. So that could be cheese, or it could be milk, or it could be sort of plain yogurt as well. Now, when I'm doing audits, this is the area that is always missing. There's always a lack of vegetables, and often the protein is missing as well. And what's not on here are the things that you can see sort of highlighted here: crisps, flavoured yogurts, biscuits, all highly processed, high sugar, high fat items. They appear quite a lot in lunchboxes, and some of these things are often missing. So what we want to encourage parents to do is obviously minimally process, not very many items that are high sugar and high fat. I would say one of these would be ample in a child's lunchbox, certainly not all three, and thinking about the portion size as well. These two lunchboxes you can see are quite drastically different. This one comes, I don't see this kind of lunchbox very often, so I had to get it from a document which is on our website from First Steps Nutrition, which is just all about helping parents and families with young children to create healthy lunchboxes. So that's on our website if you want to have a look at that. Whereas this one was a real lunchbox that I recreated for that section. Okay, last little bit then around the key oral health messages is going to the dentist. Children should be attending the dentist from any time between 6 months old and a year. So Dental Check by One is a national campaign. All dentists should be trained and happy to see babies between the ages of 6 months and 12 months for their first appointment. And then following on from that, they should be going every 6 to 12 months. I'm just giving you what we need to do, and then I will come back to access. And then dental care is free if you can get it until a child is 18 years old. Now, you may find that some children need to see special care team. So those are children maybe with physical disabilities, with things like autism, with a fear or phobia of the dentist. The special care team is there, and that's run by Oxford Health. At age 3, this picture here, which looks like a paintbrush and some strange paste, this is fluoride varnish, and this should be being applied to children's teeth every time they go to the dentist from the age of 3. Now, not all parents know that they should be getting it, so they're not asking for it, and some dentists are not doing it. So again, a good signposting one. Now, that all sounds wonderful if you can get an NHS dentist and you can get an appointment. There are people struggling because, as we know, 91% of all NHS dentists are not taking on anyone new for NHS treatment. So it is a little bit tricky. So if people haven't got a dentist and they want to access one, then you know, we do need to just sort of support them with how to do that. Now, during COVID, it did teach us that we can, the majority of us, if we are doing all those things that we've talked about today, brushing properly, regularly, using the right toothbrush for the right amount of time, twice a day, using a really good fluoride toothpaste, not having too much sugar in our diet, not having any sugary snacks, we can prevent any problems from happening, any need to see a dentist. The reason we've encouraged in the past children to go early is so that they get used to it and it's not a scary place. You know, when they're going at 8, 9, 10 for the first time, that could be very, very scary. So we want them to go very, very young so that they get completely used to it. But we know that if you're doing all the right things, you can avoid needing any treatment. And so at the moment, if people are really struggling to get an appointment at the dentist or even join a dentist, then what we're saying is prevention, prevention, prevention. Focus on what you can do at home, and it doesn't need to be expensive. You don't need to buy different Colgate toothpaste for every single member of your family. You can buy one family toothpaste. A supermarket owned one is absolutely fine, contains the right amount of fluoride, and obviously not buying sugary foods, that's going to help with your budget as well. So there are lots of, obviously, those key preventative things are really, really important. Obviously, you can use the 111 or you can use the website. If families really cannot find an NHS dentist, they've called around, they've used 111, they can call the NHS England Customer Contact Centre on this number here, who should be able to help them access an NHS dentist. I mean, there are other ways around it. You could have parents paying privately and the practice seeing the children as NHS. So there are ways around it, but not always ideal ways, and sometimes have their own barriers. But encourage, obviously, going to the dentist, and it is dental check by one. But if it's not possible, get themselves on a waiting list, keep checking, and then prevention, prevention, prevention. What resources do we have? Now, I know that you're going to be sent some links to some leaflets that we have for children especially, but we also have a great website that's got all sorts of information on it. And interestingly, I'm sure you will encounter this, that some of your families will not fluently read or speak English. And because of this, we have added what was called a Browse Aloud feature. It's actually called Reach Deck now. It's this little orange chap here. If you open any page on our website, so you could open up one of the leaflets or signpost parents to open it up, they open it up, they click on the little orange man and they choose between 100 different languages, and then that leaflet will be read out loud to them in their chosen language. So that's really, really helpful as well, and I will make sure I send the little guide along with the copy of these slides today as well. There are my references, and we finished. So I'm going to stop sharing. I really hope that the session has been useful. And if you have any questions, please do feel free to contact me. You can do so at www.communitydentalservices.co.uk and find the Oral Health Improvement Oxfordshire section, and you'll see my link there. You can email me directly there. So thank you so much for taking time to listen and take part. If you would like to receive a certificate to say that you've completed today's session and you've listened to me waffling on about teeth and dental neglect, then please do use the link that's going to be in the email and yeah, fill out that evaluation form and you will get a certificate. Thank you so much for your time. Take care. Bye.